Can everyone hear me okay? Well, good morning and welcome back to Grand Rounds. Today our speaker is Dr. Crystal David. She is a clinical assistant professor at Oklahoma State University Center for Health Sciences and a faculty member in the Department of Family Medicine. She rotates with us on our inpatient service and leads our outpatient hepatitis C clinic and supports us in the outpatient environment as well. She's board certified in clinical pharmacy, who completed her clinical pharmacy residency at the University of Oklahoma, and she received her Doctor of Pharmacy from Creighton University. She also holds a bachelor degree in secondary education and teaching. Dr. David serves as our chairman of quality improvement under the Clinical Learning Environment Review, and we are delighted to have her present today. So with that, Dr. David.
Hi, good morning, everyone. Okay, so I prepared a presentation today just to kind of go over what quality improvement means in healthcare and how we can implement it to help improve patient care. So let me get my screen shared here. Okay, are y'all able to see my title slide?
Yes, we are.
Okay, thanks so much. All right. Okay, so really, what is quality improvement about? And in healthcare, it's about making our healthcare safe for our patients, effective. We want to make sure it's patient-centered, timely, efficient, and then equitable for everybody. And so why is it important? And I guess before I start, I don't know, can you all use the little thumbs ups or whatever? And are any of you involved this year in a quality improvement project already in your department? I don't see anything. Well, we'll see. All right. So, before we do something, we need to know the why it's important. And so for this one today, we want to improve patient care, address any barriers to care that we might notice for patients, make sure we're meeting national guidelines. And then, an important thing here is it's required, at least for family medicine. I know that they need to do one quality improvement project during their residency. And so, it's important to do it because you have to. Also, if you are involved in our quality improvement symposium, you might even win some money, right? And so we'll talk a little bit about that as well. So the symposium, if you're not familiar with it, is typically held at the hospital. It's the Resident and Fellow Quality Improvement and Patient Safety Symposium. And this year it's going to be May 18th. Typically it's held in a forum where everyone has their posters displayed. You can walk around and talk to people and ask them about their posters. But of course, last year that had to change because of social distancing guidelines with COVID. And so we ended up having an all online platform for that. Now it's about 4 months away, so I'm not sure what it will look like. I'm assuming it will still be the online fashion. And regardless, I think we're going to continue with at least some form of online and in person when that becomes safe for us to do so. If you're not familiar with it, I have included the link here for the handbook. You probably have seen it in your email. I know we all get a lot of emails and sometimes those can maybe get missed, but you can find it on the website here at the medicine.okstate.edu. So I would just encourage you to look through that, even if you're not doing a quality improvement project this year, to give you ideas for how you could implement one next year and even after you graduate from residency. I know that there are some board certifications require you to do quality improvement projects even after you're out of residency and in practice to keep your licensure up. And then if you want to look at some past projects, I included a link here as well, so you can kind of peruse through those and see what have people done in the past that might let you think oh, yeah, that's something I could do and easily implement in our practice. Last year, here are the winners. So you can see our first place team was about increasing pneumococcal vaccinations in the family medicine clinic. And like I said, you can win if you participate in this. And so they won $300. Second place was from our emergency medicine department about the massive transfusion protocol, and they won $200. And then third place won $100. And this team was about from the perioperative beta blocker utilization in the hospital setting. So it was a mix of residents. I think most of them were from internal medicine and then surgery. So it's all kinds of different specialties coming together and presenting their quality improvement projects. Okay, so I wanted to go over some of the principles of a quality improvement. And this isn't unique to healthcare. This is something that all industries use. And basically, it's about systems and processes. For us, it's going to focus on patients. It's more than just that. It's about being part of a team, figuring out how to use the data that we have to improve what we are working on. So, this might be quantitative or qualitative data depending on your project. You might be looking prospectively at what you can change, or perhaps sometimes it's more effective to look retrospectively to see how things have gone and then what changes can you make. There are different models that you can look at. This is a list of some of the ones that are more common. Today, I'm going to focus on the model for improvement. And so I made this QI roadmap to kind of help us navigate through the steps of this. So it's kind of cheesy, but just stay with me. So I made little mile markers and put what the different things are for each mile. So our first mile would be coming up with ideas. And I think sometimes this is the fun part, but also can be kind of the challenging part, because I think at least for myself, I kind of want to have like my idea fully fleshed out, ready to go as soon as I'm starting. But it's okay to start with some idea, talk about it with your group, get some different input, and then make changes to it to get your final idea. And so when you're trying to come up with your idea, you want to think about what changes can we make that are going to result in an improvement. And to do that, you really need to understand the current situation, try to identify and prioritize what kind of changes you're looking at. When you're choosing a project to do for something like this, you want to think about where your gaps are between what you want to do and what you're actually doing. And I know we all get caught up pretty easily because work is really busy. We have so much going on. But when I've been thinking about projects, I think back to when I got hired in this position. And I remember when I went in for my interview, I had a whole list of ideas of things I wanted to do. Like when they were like, what could you bring to this position, right? And so I reflect back on that list because it helps me think, okay, what can I do that I really wanted to do? So if you can think back to when you were graduating from medical school and starting this position that you're in, like what did I think was going to happen? What kind of excitement did I have then? And kind of focus on that to help you come up with some of those ideas. I find that to be helpful for me. And another thing, just look at standards. Are there some standards that are not being met? For obviously I'm in family medicine, so that's my thought process here, but are patients not meeting their A1C standards for diabetes, things like that, and kind of look, what have you noticed that are trends in your area? And it's nice to think of and look at things that can show results in 3 months, because then you can look at it, see how it is, and then change it and keep going forward to improve on it. Especially for something QI related here for our symposium, you only have a year from start to finish, and really not the whole year, because you have to start it partway through the year and finish it before the year is over. So looking at something you can realistically come up with and have results in 3 months is very helpful. I put a couple of posters from years past. So this is kind of what one would look like if you haven't seen any of the posters in the past. This one was about low dose CT scans. Here's another one about blood product consent in the outpatient setting. And I mean, you can't read them on here, I know, and I don't expect you to, but I just wanted you to kind of get an idea. And this is that improving pneumococcal vaccination one that I believe was the first place one last year. Okay, so we finished our mile 1 and we would move on to mile 2. So mile 2 is once you have your idea, let's focus it and come up with an aim statement. So mile 2 is our aim. And when we're thinking about our aim, really what we want to think about is, what am I trying to accomplish? So I know I have these ideas, but what do I want to do with that idea? What's that problem I want to address specifically? And what is my overall goal? So when you're trying to come up with an aim statement, you really want to start it with words that are going to help guide you. So do you want to increase something? Maybe you want to improve something or reduce something. So these are three like buzzwords when you're coming up with your aim statement. And when you're trying to come up with it, really, you just want to ask yourself all the questions, right? Who is my target population? What are our measurable goals? How long is it going to take me to do this? And why is it really important? And then we don't want to forget to think about like, how is it going to be carried out? So when we're coming up with our aim statement, it's important to keep it focused, especially if it's something you're wanting to carry out in 3 months. And I know you've all heard this next thing I'm going to tell you about, but it's always good to think about this in our personal lives and professionally. But to keep your goals, like say SMART goals, right? So S is specific. M, we want to make sure it's measurable. A, can we even do it? Is it attainable? Relevant, and then time-based. And so when you're coming up with your project idea, keep this in mind so that you can have the best aim statement and project that will be effective for you. So I brought in a couple of sample aim statements that we can look at today. So the first one, so they started with one of those buzzwords, reduce. What do they want to reduce? Adverse drug events in critical care by 75% within 1 year. So you can see they measured it 75%. They put a time on it, 1 year. They were fairly specific. I probably could have been more specific if they were looking at a certain kind of adverse drug event, but they were specific to in critical care. And so this is measurable, it's attainable. Well, I don't know, 75% is a pretty large reduction, maybe not attainable, depending on what's going on. But they put a time on it. So here's another one. Improve medication reconciliation at transition points by 75% within 1 year. So you can see again, they started with one of those buzzwords, right? Improve. What are they going to improve? They were specific. They want to look at MedRec at transition points. Maybe it could have been more specific again, like at intake or transition between the ED and the floor or between the floor and ICU. So I think it could be more specific, but they did put a number on it, 75%. So again, it's a measurable one and a time limit of 1 year. Here's another one where they use the achieve. So there we go. 95% compliance. There's your measure with on-time prophylactic antibiotic administration. It's pretty specific within 1 year again. So you can kind of see what those might look like for you. After you've developed your aim statement, the next thing is to look at what measures are you going to be looking at. Okay, so mile 3 is measures. And really it's not, if we have an aim statement and we have ideas, it's not going to be helpful unless we know that what we're doing makes a difference. So how will we measure our changes? How will we know there is an improvement? We can't just be like, yeah, things are better, right? Because that's not very helpful and we don't really know if we're doing anything. So subjective. So some considerations here, what is your outcome? What are your ultimate results? And then what process are we going to use to achieve that outcome? So if you think about what are some things we can use to know if we are seeing an improvement or not, very easily we could, well, I don't know how easily, but these things will easily show it. So using reports like an EPIC, right? Depending on what your project is, you might could pull reports about medications that are prescribed. You might be looking at culture results. You might be looking at other lab results. Maybe you need to pull by diagnosis code to kind of get an idea there. The vaccine, was it given or not? What are our rates of that? So just a few ideas of things that you could look at that would be helpful and show you that you are making a measurable change. So once we move from mile 3, which was measures, we're going to move on to mile 4, which is going to be test it, right? So we have our idea, we made our aim statement, we have our process, and we know what we're going to measure to see if it works. So now let's go on and make those changes. And so when we're testing, we're going to test these change ideas. And you want to keep changes small. If you change a bunch of things at once, it's going to be hard to determine which one was the effective change. and then study those results after each change. That's why we were talking about making them kind of small. So you could start with a project this year, make a small change, report on it, and then next year, use that to improve even more and make a different change perhaps to see if that makes an effect for your patients. And then after we test, the big thing here now, it's not as, if we just test and we know the answer, that's great, but what's going to be most helpful in healthcare is to spread and sustain what we've done. So if you see an improvement, we want to continue doing that. And so some ideas for spreading and sustaining, you want to, maybe it's something you hardwire into the health system. So I know for us in the past, we have included some dot phrases in our family medicine template that helps us continue to do these things. Include all staff. So maybe, you did a small group of it right now, but now you want to train your entire residency program, or you need to bring in all of the front desk staff. Make sure to communicate to everybody why you're doing it, what the expectations are, and don't forget to tell them the why, right? Because you're going to get a lot more buy-in from people if they know why it's important. And then to continue to measure and monitor, because just because that change made a difference now, in 5 years, it may be obsolete. If you're still doing it, it's not going to be helpful. And so continue to look at those things. Another thing that's really important is sharing your findings with others. And so that's why the quality improvement symposium is great, right? So you can present these findings in your poster at your quality improvement symposium, and so we can share with everybody. It might work for other departments as well. We also always present our findings at our department meetings, so I would encourage you to do the same thing. And hopefully you can publish these findings in a journal depending on what you did. So that is my roadmap. I know it's a different way maybe of thinking about it. And there is another formula or process that we're probably a little more familiar with. We see it all the time. And that is the PDSA cycle. So I just wanted to take that information we just talked about and put it into this form so you can kind of see like where things would fit in with what you might already be familiar with. And so the P is for plan, D, do, study, act. So let's break it down into these 4 parts. So for plan, you want to, I figured my miles are miles 1, 2, and 3 for plan. But this is really where you're going to define the nature and scope of what you want to do, identify who's going to do it, how long is it going to take, what other resources do you need, look at that problem you're trying to solve, decide on what metrics you want to use, collect your baseline data, and make sure to get that IRB determination, right? So most quality improvement projects are exempt from IRB, but you need to make sure that's the case and submit to get that exemption before you continue on with your project. So the do would be the mile 4, which is the test, and implement training if needed, communicate regularly with your team, monitor those metrics, but don't prematurely analyze them. Just make sure that you are getting the information that you need. Study is still part of that testing mile marker. Look at that data. Have you seen an improvement? What did you learn from it? And then did you find anything that can help you make a change? And then the act would be that spread and sustain. And so you want to hardwire those changes into the system like we talked about. Use what you found. Like I mentioned earlier, you can do something this year, see what changes you made, what improvement did you see or not see, and then make a change and do it again next year. And I think we all do this kind of naturally in our practices, but this kind of formalizes it. And so just as an example, I don't know if y'all are familiar, but we've started a COVID-19 vaccination pod over here at Family Medicine. And it has definitely been a series of PDSA cycles as we've been doing it. And we joked that like every 5 minutes we had to stop and think and go through our PDSA again. And we didn't formally go through it, obviously, but what's working? Okay, did that work? No, that didn't work. Let's change it. Okay. And then we do it. We're like, oh man, it's been 5 minutes probably. It looks like we need to make some changes. And I think we just naturally kind of go through that. But you need to take that same process and formalize it when you are going through a project for a quality improvement, like poster and then paper, hopefully in the end. So actually, that is all I have. I am happy to take any questions you all have or any thoughts that you have. If you want to talk about experiences you've had with quality improvement, projects you've been involved in at OSU or even other places, any successes, I don't know, anything you want to talk about, we have some time to talk about. Okay, well, Dr. Alex, do you have anything you want to add, like thoughts on, not to put you on the spot, but I know you've probably done plenty of quality improvement projects as well.
Dr. David, thank you so much for going through kind of the stepwise approach to preparing a quality improvement project. I think it's really important. We've seen such a significant interest and preparation of these posters over the last 3 years. We've had quite a bit of interest from across our consortium as well. So this year will be a really robust symposium. So we're looking forward to it. Those residents that have not had the opportunity to put together a poster or to have the discussion, I think Dr. David did a great job of really putting together a simple roadmap, and it just takes time and effort, and we would really look forward to supporting you in any way that we can in assisting your quality improvement initiative. As you all know, this is one of the main focus areas under clinical learning environment review. Family medicine has decided to, of course, make this a mandatory expectation, and but many other programs have done so voluntarily, and we're looking forward to the interdisciplinary approach to these poster presentations in the future. So it's wonderful that we are seeing programs that are working together, like internal medicine and surgery on last year's poster presentation. We would like to see more disciplines involved, where we have pharmacy, respiratory therapy, nursing, and the residency training programs working together in a quality improvement effort. So again, thank you everyone for being able to join us here today. And thank you, Dr. David, for a great presentation and your efforts in supporting this moving.
Thanks for having me. I appreciate it.
All right. Any other questions or comments? All right. Well, bye for now then. Enjoy your day. Be safe and take care.